And hey guys, it's Wayne from WRPB, and today we're going to talk wellness. And you know, wellness has so many different places, and we've done pieces on wellness, but with me is Kathy Riccio from Riccio Wellness, and you're actually an acupuncturist.
I'm an acupuncturist, yes.
Okay.
A licensed acupuncturist.
Oh, good to add in.
Let's start there.
Yeah, that's a good place to start. All right, why did you choose that career?
Well, I always wanted to be in the medical field in some way.
Mm-hmm.
And I think that being in and out of hospitals as a kid with my asthma and on medications and things like that, knowing how doctors are so good at helping people, I just wanted to expand on that. I actually went to school for only one semester to be a radiology technician.
Mm-hmm.
Starting there, seeing how I like it, I flunked out. So that was an interesting feat, but I felt like it happened for a reason.
Right.
And then also experiencing acupuncture firsthand after a car accident, I was like, whoa, my pain's gone, and this is super relaxing. I would fall asleep every time I went. And I just kind of decided to shift from Western medicine to Eastern medicine, traditional Chinese medicine. So.
Okay, acupuncture has a bunch of different pieces.
Yes, different modalities of Chinese medicine. Acupuncture being the main one people know about, as well as there's the herbs, there's cupping, gua sha, tui na.
Gua sha. And I know we went over this in the green room, but okay, you can tell them again.
So gua sha is a scraping technique that we use a tool for. It's usually made of jade, there's buffalo horn, plastic, there's all different materials of it, and it's a scraping technique that you use the tool for as you scrape the skin. It does have the same end result as cupping would have, where you get those hickey marks that kind of look red or purple, but for me, sometimes I like to use it when the cupping seems to not be working for someone and I don't see anything coming up, but I know they have pain or stagnation. So I'll use this technique to help brush away the fascia. And fascia...
Okay. Beat me to it.
I did. So fascia in the body, I look at it like saran wrap. And when we try to take saran wrap out of the little box and cut it off, and if we don't grab it in time, it kind of crumples up into this ball of a mess. That's what it can do in the body, the fascia. So using gua sha tools to scrape out that fascia and smooth it out help to alleviate the pain more for people. And sometimes I'll see better results doing that than cupping. So it depends.
Okay, so I see people hear acupuncture and the first thing they hear is needles.
Yeah.
Is that the main part? Because for me, I've already filmed and seen cupping. Mm-hmm. I think that's so cool, okay, because it's done with cups and fire.
Yeah, it's pretty awesome. It's one of my favorite things to get and do. So,
okay.
Yeah.
Now, everybody handles it a little bit differently.
Yeah.
What is cupping? We'll get to the needle part in a minute, guys. Hang on. The cupping part. What does it actually do? So you put this liquid in this bowl or cup?
No. So what you're actually doing is you take a hemostat, and it looks like scissors, but it's just got the clips at the end, and it locks in. So you take the cotton ball soaked in alcohol, clip it onto the hemostat, light that on fire, insert it into the cup really quick, and then put it onto the body quickly.
Okay.
So the heat it's creating that heat and that suction to make that skin kind of go into the cup.
Why do we want to do that?
Because it's looking for oxygen. So cupping is really good for alleviating pain, promoting circulation. If you have a cough and you do it on your back, it can help to loosen the phlegm in your lungs and in your chest. And it's just really awesome. It feels like I like to do the sliding cups, so when they're on the skin, I'll use coconut oil or an herbal ointment or liniment, and then I'll do the sliding cups, so it's more of a deep tissue massage. Some people don't like that. They say it's a little painful, but I like it, so I just go with what the patient says.
You like me, have some tattoos, so a little pain doesn't.
Well, it's funny. I have friends that have many tattoos and are acupuncturists and don't even like needles.
Really?
So it's really funny how that works. But
now, if I was going, I would go with the cupping because I don't like. It's not even that I don't like the needles. It's I don't like the needles sticking out of it.
It seems weird, but the needles are really, really thin. You can actually fit about 18 to 20, I'm not exactly sure, inside of a hypodermic needle. Wow. So the needles that the doctors are using, you can fit multiple acupuncture needles inside of a doctor's hypodermic needle.
Is it, okay. And I'm going to use the word painful, but I don't really mean painful. Do you feel it Is it like a little pinch when it goes in?
When it goes in, you can feel a little bit of a pinch, but as soon as that dissipates, you shouldn't feel any pain. It should feel actually like, sometimes you'll feel a heavy sensation at the site of a needle. You might feel a sensation going down the arm or leg or wherever it may be. The best is when someone comes in for a back treatment and they have tightness in their glutes or their butt, and you actually can release the muscles. So when the needle goes in, it'll get that trigger point, so to speak, and you'll see the muscle jump, and then it just releases, and people feel instant pain relief after that. So
How many needles does acupuncture take, or does it depend on what you're trying to fix?
I think it's different for everybody. I've seen practitioners use lots of needles, and I've seen practitioners use almost no needles. But again, it's also depending on what the person's coming in for and how many you want to.
Well, they're coming in for back injuries because we live in Florida and everybody's been in a car accident, so everybody has a back injury. So where are we going with that?
We drive a lot, so we're sitting a lot, so I get it, yeah.
Okay, so we've been in a car accident, we had a back injury, we have herniated discs and that stuff, so they come in for the back.
Yeah. Okay, so I think if you're coming in for back pain or a back injury, maybe 15 to 20, and that's minimum, I would say, because doing a whole back treatment. But again, it depends on other things that are going on, because you don't want to just focus on the back. You want to do points on the arms and legs as well to kind of do a whole body treatment.
Okay, and then you lead me into exactly what I wanted to say.
Awesome.
So you were thinking about Western medicine when you started. You went to Eastern medicine.
Yep.
Eastern medicine is almost like a circle. It's about the whole body. It's not about, hey, I have a pain in my back. All right, here is an OxyContin, take it, and the pain will go away.
Yeah.
Here it's about figuring out why and how to fix the whole thing. Because the problem can be in your leg, but it could come from your back.
Right.
Okay, so that's the cool thing about Eastern medicine.
Yeah, it's pretty awesome.
Yeah. So now you decide to start your own practice.
Yes.
Okay. I mean, like, who's your clientele? Is it people that come from orthopedic surgeons? Is it people who just have back pain? Is it people who work out at the gym too much?
It's a little of everything, to be honest. I mainly like to treat anxiety and depression. That's like my niche. But I try to do everything, whatever people come in for, just to kind of always keep me on my toes. And I never wanted to be one to be specific in one type of treatment for one type of thing. But I think a lot of people do come in for pain. That's what I see a lot, especially
that's
being
what
at
I
the
would
gym.
think.
Yeah.
And that's why I'm trying to disseminate this information to you guys.
Yeah.
Because you know what? Now I'm going to hit her up with anxiety and depression. I would never, for me, that is all about pain. Acupuncture is about taking away the pain, but it's not.
It's true, because that's what a lot of people think of it as a last resort. Like, you've gone to doctors, you've gone to pain management clinics, you've gone to PT, chiro, this, that, and you're still in pain and you don't know why. So I think for acupuncturists, generally speaking, with the pain we're dealing with on a muscular level, on a neurological level, where a chiropractor is just adjusting, the structure.
Right.
And even massage therapists, all those things in conjunction, they all work
and they have their
with
place.
each other, right?
Including Western medicine doctors.
Yeah. So I think for anxiety and depression, I find that working amazingly for my patients that have issues in those
Acupuncture
departments. Yeah. Yeah.
Needles? Mm-hmm. Yeah, I can understand that. It's like, hey, if you don't stop with the depression, I'm going to give you more needles. You better stop with the damn depression, or you're getting more needles.
Yes and no. No, I'm kidding. No, it's interesting, though, because people, it's not just about getting the acupuncture. So
Right.
for me, with my patients, I try to give them the space to heal on a deeper level. Not just, all right, I'm going to stick some needles in, we'll call it a day. For me, the treatment starts and the healing starts as soon as my patient walks through the door and we're talking. Because you have to give a thorough exam, you have to ask a lot of questions, not just about your anxiety and depression or your pain or whatever. It's a whole body treatment. So we're asking questions about everything, from your sleep, your bowel movements, your digestion, everything. So I think with the anxiety and depression, just being able to allow someone the time and space to tell me what's going on and me giving them honest feedback that's valuable to them. that's really where their healing starts. And then they get better on their own because they have to do their homework. They have to either exercise or change their diet or drink more water or do things to help themselves outside of just getting the acupuncture treatment. So they find a lot of value in that.
It's important, and I told you guys many times, to be able to be part of your diagnosis because you know your body better than anybody else.
Bingo.
I had a big to-do because there are things that I know through life experiences, and in 2010 they were treating me for pneumonia, and I didn't have pneumonia, but I didn't know that, and they were treating me with antibiotics, and they put me in kidney failure.
Oy.
And the doctor came up and said, "You're going for dialysis," and I said, "No, I'm not.
Oh my gosh.
Send up someone else." And he said, "Well, it was medically induced. We can probably turn it back."
Wow.
So I went from a 5.1 creatinine level, which is extremely high, and dialysis. I went from not taking dialysis, and they brought me down to a 1.1.
Wow.
And I knew it only because my first wife had kidney failure and kidney transplants. So I knew something about nephrology.
Right.
In 2010, when
You become a specialist in, in these
Right.
issues once you're...
Right, and they're bringing up Ensure, and you can't really have that, and they're giving me a banana, and I'm having creatinine levels that are high. Yeah, that's no good. Well, I have a lung illness that's very rare. So, I go in for kidney stones, couple or whatever, and they now say that I have, when we don't use the word, so I have this pandemic disease, okay? And I'm telling them, no, I have a lung illness that's very rare.
Right.
Finally, I have to fight to get a pulmonologist up because they're going to give you antibiotics and stuff, and my thing is treated with steroids. So I'm trying to, and then the charge nurse came in, and she was so impressed that I was able to help with my diagnosis,
Right.
because that saved them from doing things that they didn't have
Absolutely.
to do. Is there ways, only because of interviews I've done, are there ways to like look at someone's hands or their tongue or whatever?
Yes.
to
So
tell-
that's, yes, absolutely. It's a good
Okay.
point you brought that up. Thank you. So we do tongue and pulse diagnosis in
Okay.
Chinese medicine.
Okay.
So as strange as that may seem, we're always looking at tongues, and that gives us a better idea what's going on inside the body.
Okay.
So each part of the tongue represents a different organ. So that's how we can kind of narrow down what's going on in which specific organ. As well as the pulses. So the pulses would be the Sun Guan and Shi is what we call it, and that's the upper, middle, and lower. So that would be the upper, middle, and lower jiaos is what they called. And so that is, again, when we check your pulse, we're diagnosing and seeing what's going on in the different parts of the organs and body as well.
Because she falls on the Eastern medicine side, and that's a circle about everything, not about, oh, I have a pain in my elbow, I'm just going to work on the elbow. Because just because you have a pain in the elbow doesn't mean it's coming from
Right.
the elbow.
That's what we call like the root branch treatments too. So the branches could be your headaches or your pain, but the root cause could be something that you were completely unaware of.
Okay, well, we're running out of time, but I really wanted to get back for a minute
Yeah.
to this anxiety and depression scenario.
Yes.
Because a lot of people go through depression.
Especially after this pandemic, I'm sure, I'm almost positive suicide rates have gone up,
Yes,
as well as
27%.
anxiety and depression. So
Okay.
that's another thing that we can tackle for not only the youth, but everyone.
Okay, so many, many years ago, I was in a car accident, and it messed up my lymph glands, and my face would swell, come out to here. then
It had
this would
nowhere
come
to
out here,
drain.
Come out to here.
Yeah,
I would go to the hospital with my face like this, and I'd have to put a towel over my head because I'd scare everybody.
right.
Finally, I went to an ENT who told me what the problem was. But the interesting thing about it is, it's put me, from that point on, after it cured, it put me in times where I get anxiety that my face is swelling, and only when I'm laying down. Now it's not happening.
It's not
But I
happening,
have
but-
the anxiety, and I have to get up and walk around, and walking around takes away that anxiety.
Yeah.
But how does acupuncture help with anxiety? How does getting needles or cupping or whatever, how does that help with anxiety?
That's a good question. So, with the anxiety aspect, we look at it like the energy is all in the top part of your body. So we want to ground you and bring it more down, rather than being up here in your head, like literally. And this is simplified terms. I'm not getting too technical about
No,
it, but
but-
the actual aspect of your anxiety is happening because you're all in your head and your thoughts are going crazy and you're not grounded enough. So with anxiety, we would probably do more grounding points to root you down and not have you all up here. Like with depression, it's the opposite. Everything is all down.
Interesting.
And you want to bring everything up, the energy back up. So, because it's the energy of your body. If there's an imbalance,
I
we
buy
have
into
to
it.
kind of, I consider it like a conductor of a train. So the needles are the needles are the train and I'm the conductor, and just, you're doing your own thing. Your body knows what to do once we kind of get it in the right motion.
Oh my God,
So-
you're giving me like all these points. Because I always say that our bodies are meant to heal themselves.
Absolutely.
Sometimes we need a kickstart.
Yeah, that's
Okay.
it.
The other thing that's interesting is you use the word grounding.
Yeah.
And I get yelled at constantly by my doctor to go to the beach, take off my shoes, and walk in the sand.
Can I stop you for a second?
Yeah.
As soon as you said you have bouts of anxiety when you get that moment of like overthinking about your swelling of the face, and you said you walk around. That's why I brought that up, because that is what you're doing and you didn't even know.
Right.
But if you do it barefoot in the grass, you'll have an even better result.
Right. And, I have a good friend who kind of was one of the inventors, for lack of a better word, of IV therapy.
Okay.
And he did 115 pounds of blood work on me and an ANS test. Most
Okay.
people never heard of an ANS test because I didn't. It's an electronic test. And it's the only test, he says, that will detect a heart attack, a potential heart attack.
Oh, that's
so he
cool.
said, so he called me in the office and he said, after all the other bad things he said about that I'm falling apart, he said, this is life, this is the beginning, this is the event, meaning the heart attack, when you're here. So you need to change your diet, and you need to go out, and you need to walk on the beach, walk on the grass barefoot. Well,
Yep.
I'm a guy, so we're stupid. So I didn't
Hard-headed, yeah.
I didn't do
Are
any
you sure
of
you're
that.
not Italian? No, I'm kidding.
I didn't do any of those. 10 weeks
course you
later,
didn't.
I had a heart attack. Okay. and
He
so-
told you.
And I play that in 10 weeks. So I'm like, you have a voodoo doll? It's like, really? Did you wish this off me? I was like,
No,
so-
nobody wishes that on anybody. But that's another thing too. Sometimes we're told the same thing because we could tell people like, hey, do you have, like, just feeling somebody's pulse? We could see if there's palpitations. We could see if there's pain just by the way the pulse feels. So people that are in this field and doing things like this, like your friend, we're not psychic, we're not witches, we're just proactive and being educated on the modalities of medicine in general.
Eastern medicine is very interesting, and if you don't know anything about it, this is 2021. Go to Google. It's not political, so you don't have any problem. Just go and look it up, and you'll learn some things about it. How do people get in touch with you?
RiccioWellness.com, Riccio Wellness on Instagram, and I am inside Mission Fitness and Wellness Gym, located at 460 Southwest Port St. Lucie Boulevard. It's between Cameo and Bayshore Boulevard. I have a little office space in there, and my website, you could book your appointments on there as well. And
Perfect.
Yeah,
With that, I want to thank you for coming on.
thank you.
Everybody have a great day, and we'll be right back.
Bye.